So today I'm going to be summarizing my outline for how I would be treating a cancer patient as a nurse. Starting off, when I would greet the patient, I would let them know my name and that I would be their nurse for the day. And I'd pay a lot of attention as to my facial expression and my body language and make sure that I am making them feel as comfortable as possible while they're getting ready for their surgery. The goal and the purpose of the surgery, I would just explain to the patient that the goal is to remove all cancerous cells from the skin while sparing the healthy tissue and leaving the smallest scar possible. That I would let them know that this procedure has been proven the most effective at treating basal cell carcinomas. As far as letting them know what type of skin cancer it's treating, obviously they would have to be referred by a specialist doctor. So I would start off by saying your dermatologist referred you to get the surgery to remove the basal cell carcinoma, which is a type of skin cancer. And I would give the patient a little bit of background information as far as how someone might get basal cell carcinoma and a little bit of information on that specific skin cancer. I would let them know that the integumentary system forms the entire surface of the body, while the biggest organ is the skin. And the primary function of the integumentary system is protection against things such as UV rays from the sun. So the patient being from an area where they're close to the beach and had a lot of sun exposure would explain the reason for this skin cancer. I would let her know that sometimes the damage from the sun exposure, like I mentioned earlier, can cause skin cancer, such as basal cell carcinoma. And this type of skin cancer causes tumors to arise from the epidermis and can be dangerous if not treated. Now, because the patient might not understand all of the terms, I would also let her know, in simpler terms, it's a type of skin cancer which results in a tumor and it affects the outer layers of the skin. As far as who's doing the procedure, I would let the patient know that the procedure is performed by a surgeon who is specially trained in Mohs surgery, pathology, and reconstructive surgery. Just a little bit of the main procedures and instruments involved. The procedure is done in stages while the patient waits for the lab results. I would let the patient know, in preparation for the procedure, the surgeon will inject a local anesthesia, which will numb the area completely. And since the basal cell carcinoma is on the patient's face, I would let her know, while you might not be able to see what's going on, the surgeon will talk you through the entire procedure to make her feel a little bit more comfortable. I would let her know that the procedure is done using a scalpel. The surgeon removes a thin layer of the cancerous tissue and then examines it under a microscope. Before she waits, a nurse will bandage her wound and show her to the waiting area where she can wait until the lab results are done. I would let her know if any cancer cells remain. The surgeon will check if she needs more anesthesia, and then remove another thin layer of tissue from that precise location where they found it under the microscope. And his main goal throughout the whole process is to spare as much healthy tissue as he possibly can. And, I would let her know that this procedure is repeated until there's no cancer cells present. As far as time length, I would let her know that the entire process can take up to several hours, and the only thing that really alters or affects the time length are how many rounds the doctor or the surgeon has to do before there's no cancer cells present. As far as explaining the risk of scarring, I would say something along the lines of since this is a surgery, there is a risk of cicatrix, which is a clinical term for scarring. However, most surgery delivers the best cosmetic results and the lowest rate of recurrence than any other treatment and the highest chance of a complete cure. So, as long as the biggest, most important part after the surgery is done is that the patient follows the doctor's instructions for wound care, scar care, and follow up to achieve the best outcome and minimize the risk of scarring. So that's very, very important, and I would make sure that the patient fully understands the importance of that to reduce the scarring. At the end of all that, I would schedule a follow up and just let her know, we need to see you in about a week to remove the stitches. Is there a day and time that works better for you? And I would let her, kind of let me know, well, this day and this time works, and schedule it at whatever day and time is the most convenient for the patient. And that is about it for my outline. Again, the most important part when interacting with the patient is to make sure that I make them feel as comfortable as I possibly can, and that I don't rush the information, because from a patient's perspective, the information can be a lot and can overwhelm the patient before the surgery, and that's the last thing that a nurse or anybody that is interacting with the patient would want to do. So on the day of the surgery, getting them checked in, I would just want to make sure that I do everything in my power to make them feel comfortable, and to make them feel comfortable with the surgery, and make sure that they know every step of the procedure and everything that to expect, from the slightest risk to the most rare symptom that they could have as a risk.